All right. Well, good afternoon, ladies and gentlemen. Thank you all for joining this afternoon's COVID-19 briefing. I'm Nirav Shah. I'm the director of the state of Maine CDC, and I appreciate everyone accommodating this slightly different format. Before we dive into some of the numbers, I'd like to provide everyone a recap of why we're doing the briefings in this manner for this time period, and where things stand with the situation at the State Emergency Operations Center. As a recap, Wednesday evening, a number of individuals in and around the State Emergency Operations Center, which is located within the Maine Emergency Management Agency, began reporting signs and symptoms consistent with COVID-19, fevers, muscle aches, and chills specifically. We immediately worked with our colleagues in the National Guard to offer all of those individuals who are exhibiting symptoms testing for COVID-19. I'm pleased to report that each and every one of those tests has come back negative. That's a good sign. However, out of an abundance of caution, Director Pete Rogers and I, the director of MEMA, decided to undertake additional efforts at the MEMA location to provide additional safety. For example, deep cleaning, as well as an epidemiological investigation to try to figure out what might have been going on that led to a fair number of individuals exhibiting the same signs and symptoms. We know that it was not COVID-19, but our overall public health investigation is getting underway right now. We may not define anything. This is the time of the year when a lot of folks exhibit or have spring colds and the like. But out of an abundance of caution, the State Emergency Operations Center remains in virtual mode. Now, I'd like to emphasize one really important thing at the top. The fact that the State Emergency Operations Center is virtual does not mean that it is closed. I repeat, the State Emergency Operations Center is fully open and operational. In fact, yesterday, between Maine Emergency Management Agency and the Maine CDC, 100 requests for assistance were fulfilled. So the Maine Emergency Management Agency's Operations Center remains fully operational. It had already been operating in virtual mode at about 80%. But with the events of the past 48 hours, we've gone from 80% operational to 100% virtual. And that process is continuing right now as we determine what, if anything, what conditions may be needed to satisfy before folks can re-enter the Emergency Operations Center. Again, overall, the state operations around COVID-19 have been uninterrupted. All of the response activities have continued uninterrupted over the past 48 hours, and they will continue uninterrupted. Situations of this nature where there might be displacements in the workplace are what we plan for and what we have continuity of operations plans for. Situation, Director Rogers and I conferred early yesterday morning and decided to activate those contingency continuity of operations plans and moved all of our staff to virtual operations. But notwithstanding that, again, we still fulfilled 100 requests for assistance yesterday. On top of that, we were both pleased that all of the individuals who were tested all came back negative for COVID-19. One of the first pieces of our overall health investigation is that we're taking some of the samples that were sent to Maine CDC's lab in Augusta for COVID-19 testing and running other tests on them for other potential viruses and bacteria, certainly with the consent of all the patients. So we're looking to see what, if anything, might have been going on, or if it was just a potential coincidence that, given the changing of the seasons and the warmer weather, folks just all sort of felt crummy at the same time. We'll know more in the coming days as our investigation unfolds and proceeds. But for right now, out of an abundance of caution, we're keeping all of the operations virtual, even though they're still fully on board. So with that, I'd like to turn to some of the numbers today. Unfortunately, Maine CDC is reporting the passing of another individual with COVID-19. This individual was a woman in her 80s from Cumberland County, and her passing marks the 85th death associated with COVID-19 across the state of Maine since we began our activation. We offer our deepest condolences to the family of this woman during this time of their grieving. Overall, across the state, there are now 2,226 cases of COVID-19 statewide. That represents an increase of 37 cases since yesterday. Of those 2,226 cases, 1,971 are confirmed, an increase of 20 since yesterday, and 255 are probable, an increase of 17 since yesterday. Overall, 270 individuals have been hospitalized, an uptick of 6 since yesterday, and 53 individuals are currently hospitalized. Of those 53 individuals, 18 are in intensive care units and 35 are in non-intensive care units. Right now, across the state, 12 individuals remain on ventilators with COVID-19. As I mentioned, sadly, there have been 85 individuals who have passed away and 1,458 individuals have recovered, an increase of 56 people who have recovered across the state. Of our 2,226 cases, 523 are among healthcare workers. I'd like to provide an update on some of the outbreaks that Maine CDC has been involved with. The first is a new outbreak that we are reporting today at the Granite Bay Care facility in Saco, where there are 3 individuals affiliated with that facility who have tested positive for COVID-19. Next, at the Procter & Gamble facility in Auburn, Maine CDC is investigating 7 individuals associated with that facility who have thus far tested positive for COVID-19. We're working very closely with the management of that organization to arrange for them to conduct universal testing across all of the individual employees in that facility. As we understand, there are roughly 360 full-time Procter & Gamble employees and roughly 120 contractors. At this time, I'd like to emphasize our investigation is just getting underway, and a critical piece of that investigation will be to try to understand whether the manufacturing plant was the source of transmission itself, or whether it happened to be the case that other individuals across the community who independently contracted COVID-19 happened to work there. That'll be one of the key areas of investigation as we move forward. Next, at the Cape Memory Center in Cape Elizabeth, another round of testing, or now retesting, has been completed at that facility. And overall, there have been 78 individuals associated with Cape Memory Care who have tested positive for COVID-19. 55 residents and 23 staff have now tested positive. Sadly, there have been 4 individuals who have passed away with COVID-19 associated with Cape Memory Care. We continue our work with Cape Memory Care to make sure that they have everything they need, whether it be PPE or guidance on infection control practices, as well as care for the residents and the staff who work there during this extremely challenging time. Next, in terms of some of the vital statistics that Maine CDC tracks, at present across the state, there are 395 total ICU beds, 138 of which are available. There are 319 conventional ventilators, 241 of which are available, and there remain available 441 alternative ventilators across the state. Finally, a quick update on some of our public health emergency preparedness activities. As I mentioned, even though we shifted our operations to virtual operations yesterday, Maine Emergency Management and Maine CDC jointly filled 100 requests for assistance across the state. Overall, of those 121 were orders of PPE that were fulfilled by Maine CDC. Just yesterday alone, in the midst of shifting to virtual operations, Maine CDC staff filled 21 orders for PPE, comprising 20,190 pieces. That's 20,190 190 pieces of PPE that were delivered across the state yesterday during a day we were shifting the nature of our operations. We've also been focused on sending out swabs and viral transport media to healthcare workers across the state. Thus far, Maine CDC has filled 71 orders for swabs and viral transport media across the state. Those 71 orders represent 17,675 swabs. That's 17675 swabs. And 15,269 viral transport media vials. That's 15269 viral transport media vials that Maine CDC has pushed up to healthcare providers and clinics across the state. We're continuing the process of doing so. And in fact, just 2 hours ago, we received word from FEMA that tomorrow Maine CDC would be receiving approximately 13,000 swabs and 22,680 vials of viral transport media. We will immediately inventory those and put them in the queue for delivery as soon as possible. We know that right now, it's all well and good to ask clinicians to test patients, but unless we them with the swabs and the transport media to do so, they won't be able to conduct those tests and send them to the Maine CDC laboratory. So right now, one of our key areas of focus on the public health emergency preparedness front is pushing out swabs and viral transport media. Before we turn to questions, I'd like to just say a few words about where things stand and where we might see it going. There's a lot of discussion going on right now, of course, about where we are in this outbreak. And as we've talked about during these meetings, it's very difficult to know in the midst of an outbreak where one stands. But there are 2 things that I've been thinking about that I wanted to share with everybody on this Friday. The first is that one of the words that has been used to describe the COVID-19 outbreak, I think perhaps more than any, is that it has been unprecedented. What does that tell us about the next outbreaks that we might face? Because now, a situation of this nature, a global pandemic, is no longer unprecedented, but rather precedented. And so one of the things that my team and I have started thinking about is not only where we are right now, but where we need to go and where we need to be after COVID-19 has wrapped up in order to be ready for the next situation, whatever that may look like. Again, to the extent that COVID-19 was unprecedented, we now have precedent for it. We have an obligation as a nation, state, as a series of communities to make sure that we take into account the fact and no longer take for granted the fact that outbreak that occurs and pops up in central China back in early January has the distinct possibility of affecting us here literally across the world in Maine. So that's something that our team and I have started thinking about. The other thing, as I've been chatting with my team just over the past 48 hours with the changes to a virtual operation and contending with individuals on our team who might have tested positive for COVID-19, if the test come back in a different manner. One of the things that emerged pretty clearly is that a lot of us are feeling the great weight of contending with COVID-19. I suspect that's true for everybody who's watching right now. In our situation, all the tests that we sent for COVID-19 were negative. But we know now for thousands of people in Maine, when they were in that waiting period, waiting for those test results to come back, for now, over 2,200 people, when they got those test results back, they came back positive. Can only begin to imagine the psychological weight that carries with it. On our side, our team has every single day for the past several months tried to make sure that we were balancing the obligation that we have as public health officials to take care of the state with our own obligation to make sure that we were staying healthy and making sure we were able to come to the job every single day. But that obligation isn't one that is unique or confined to officials. It's one that we all have for the sake of our families, for the sake of our communities. We all have an obligation during this time to stay healthy and to stay safe, if not for ourselves, but again, for the sake of our families and our communities. And so as we go into a weekend with expected to be good weather, I ask everyone to do what I like to ask on every Friday, which is please take time this weekend to take care of yourself. So with that, I'm going to turn things over to our colleagues in the media. And the first question today goes to Sarah from the Machias Valley News Observer.
Thank you, Dr. Shah. Can you hear me?
I can. Go ahead, Sarah.
Okay, great. Thanks. So as you're aware, face masks have become a controversial subject, and we have some readers who ask why the World Health Organization's guidance on face masks differs from the CDC. The WHO recommends face masks if a person is symptomatic or if someone's working with a COVID-19 positive individual, not really as comprehensive as CDC recommendations. And they also wonder why early in the pandemic, official guidance within the US seemed to steer people outside of healthcare away from wearing masks. So can you speak to these differing recommendations and how the state has chosen its current guidance?
So we generally follow the guidance of the US CDC. And in this situation, I think they've got it right. One of the things that has changed over the course of this pandemic is our understanding of the significance of asymptomatic transmission. When the pandemic first emerged in China, spread across Asia, the nature of asymptomatic transmission of the virus was barely understood. It wasn't until the first cruise ship situation, I believe it was the Diamond Princess and then later the Grand Princess, where it emerged based on the epidemiological understanding of those outbreaks. We realized that a significant number of individuals were getting sick, but only came into contact with people that had no symptoms themselves. That's when the entire concept of asymptomatic or really pre-symptomatic transmission emerged. Right around that time, once the scientific data demonstrated that pre-symptomatic transmission was a significant feature of COVID-19, I think what you saw, at least in the United States at the CDC level, was a shift in the guidance. Once we realized that asymptomatic or pre-symptomatic transmission is a significant component of the overall spread, the value of face masks or face coverings becomes immediately clear. So I don't think this was a change in position so much as a change in the understanding of the science. That's how the scientific process works. This is a situation where when the data changed, the recommendations and policy attendant to that data changed alongside it.
Thank you.
You bet. I'm going to turn next to Brian Sullivan at WABI.
Thank you, Dr. Shah. I was wondering if you could just give us a little more on the epidemiological investigation into the 7 people that you had to test. What have you learned since Wednesday night when this investigation started that they might have all had in common or done together? Is it as simple as they all ate from the same dozen donuts or something like that? Can you tell us a little bit more?
Sure thing, Brian. So the one commonality among all of these individuals is that they spent some degree of time in the State Emergency Operations Center. It did vary. I'd like to underscore something that Director Rogers mentioned yesterday. Even though they were physically located in the State Emergency Operations Center, there have been strict protocols in place to limit physical interaction, even within that center. Tables have been spaced out to a great degree, and as you heard Director Rogers and I mention yesterday, even people that are sitting 20 feet apart times will do meetings on Zoom just to be safe. So we don't know that we haven't seen any evidence of a lot of direct personal interaction. So that's where our investigation is looking at other possibilities. They've all been at a separate location outside of the EOC. I can report, however, that based on the reports that I received this morning, most all of the individuals are feeling better, if not significantly better. So that's a very positive sign. We're hoping that whatever may have ailed them was something short-lived and certainly not a longer type of situation. Again, the reports that I received this morning from our teams were that all individuals who had been feeling a little crummy were feeling significantly better today.
So do you see that as a large coincidence that these 7 people that all in the same location all felt extremely sick and had the same symptoms on the same night?
Well, I want to just, on one note there, Brian, I don't know that any of them felt extremely sick. They all had symptoms, fever, and muscle aches. I don't think that any of them felt that they were in a position where they needed to go to the doctor or needed to go to the hospital. The protocol at the Emergency Operations Center is that before you can come in, if you're not feeling well in the morning, you have to make a phone call to call in and report that you're feeling well. So they followed those protocols and notified Director Rogers and his team. I don't know that any of them was feeling extremely sick. And they are all feeling significantly better now. Now, whether this was related to common exposure that they might have had, or whether it was just a coincidence based on the changing of seasons and the changing of the weather, that's the focus of our investigation. I can't speculate right now on what we might uncover. As I mentioned, we are taking the samples that we drew for COVID-19, the nasal samples, testing them for other bacteria and viruses at our lab with the consent of all of the individuals. Once we've got some results there, we'll see what we find. There are a fair number of viruses that are still circulating. Joe Lawler noted this yesterday, but even though we are in a time of COVID-19, there are still a number of other viruses out there, including the common cold, which is still floating around. And I don't know about you folks, but for me, anytime the seasons change, I usually have a 36-hour period where something hits me. And a lot of times that can be the common cold. So unclear what our investigation will reveal at this time, but an abundance of caution, we wanted to make sure that we could keep our operations up. That's why we decided to move to virtual yesterday.
Thank you.
I'm going to turn next to Amy Brown at WRU. Amy? All right, we're going to circle back to Amy in just a moment. I'm going to turn to Pat Callahan, News Center next.
Yes, Dr. Shah, can you hear me?
Yep, go ahead, Pat.
You're no doubt aware, of course, that there were a number of restaurants in Cumberland and York and Androscoggin County preparing to open for dine-in service Monday. Just a couple of days ago, the plan was changed. They're pretty frustrated by that. Can you speak to the numbers that led you to recommend the decision? And also, does it have to be countywide, or can you start isolating areas of different counties because some are more urban, some more rural?
Sure. So the numbers that we look at as we think about any public health policy decision, it's not just a single number. It is an array of different values we take a look at. In this particular situation, it was not just the aggregate number of cases, but also the uptick in new cases in recent days. It was also the overall per capita rate of cases, which for those 3 counties, significantly higher than every other part of the state. Even adjusting for population, there's just more COVID-19 there. We also were concerned about other epidemiological factors, given the uptick, for example, an increase in the number of hospitalizations, which is independent of any type of testing. So those are some of the factors that we looked at. But Pat, you asked if whether in the future these decisions can be made at a more granular level. It's a dangerous proposition. What we know about COVID-19 is that it spreads incredibly quickly. It really is like that you happen to find in one part of your house, even though you haven't been in that room for weeks. And the last time you used any glitter was weeks ago down in the basement. What we know about COVID-19 is that it will pop up across the state, across any area, even if it's currently not listed. What I like to say, or how I like to think about it, is that the absence of evidence of COVID-19 is not evidence of absence. Given how often and frequently people can go from one place to another, even within the same county, and the amount of travel, the amount of interaction we all have across the state, making public health policy decisions based on whether there are a number of cases in one zip code or another could yield not only false conclusions, but also a false sense of security. To put a fine point on it, if this were 1820 and people didn't move from town to town hardly at all, then perhaps that mode of analysis would work. But it's not 1820. We know that people can and do move from city to city, zip code to zip code. And so making policy decisions on that basis is something we have to think about very carefully. That's why right now we're doing it on a larger scale.
Thank you, Dr. Shah.
You bet, Pat. I'm going to turn next to Isha at the BDN.
Hi, Dr. Shah, can you hear me?
I can. Go ahead, Isha.
So I have two questions today. The first one is, what is the CDC's response to demands to establish a task force to track and address the disparity of Black and immigrant Mainers who've become infected relative to the overall population?
So we've had a number of conversations with minority and immigrant populations across the state. And the team that's working more broadly on COVID-19 has for many weeks, many months, engaged in very fruitful and productive conversations with representatives of those communities to understand what their needs are, what they'd like to see in a response, and then act on those requests. We've continued those conversations. I personally have been involved with a number of them. So we've continued those conversations. As it relates to their requests for a task force, I would refer you to the governor's office for those. The governor's office will have to sign off or would have to officiate any such task force. But I do want to note that we have had very frequent and engaging conversations with members of each and every one of those communities throughout the course of the COVID-19 outbreak to make sure we were hearing their requests and trying to act on them as quickly and expeditiously as possible.
Thank you. My second question is, what kind of alternatives to the 14-day quarantine is Maine CDC considering for anyone coming into Maine? And what would be the timeline for any changes to that? And also, are there any updates on plans on testing for out-of-state people?
Sure. So in terms of updates on, sort of other ideas around the 14 quarantine, there are a number of discussions that have been had. And right now we're in a situation or a position where all ideas are on the table. Some of the ideas involve asking individuals to quarantine prior to their arrival. Others involve asking individuals to obtain some sort of demonstration that they've had a test in recent days. And then other ideas focus on the point of interaction or the point of service specifically. In the point of service idea, that involves much more frequent temperature checks and symptom checks for individuals, for example, before they might go into a restaurant. So it's a situation where there won't be a single approach. There's never been a single approach to anything, but rather a collection of approaches try to have multiple checkpoints and safes in place to minimize that risk. Now, in terms of testing for out-of-state residents, that's also something that's being discussed and worked on. It's an idea that we've been thinking through. We want to make sure that we not only offer testing, not just for out-of-state residents, but of course for Maine residents first and foremost, but also make sure to get their results in a timely manner so that they can act upon them if they happen to be positive. I'm going to turn next to Brad Rogers at WGME. Okay, we'll swing back to Brad in a second. And while we're doing that, we'll check in with Amy Brown at WERU to see if Amy's back.
Thank you, Dr. Shah. Can you hear me this time?
Yep, go ahead, Amy.
Okay, great, thanks. What kind of virus could have potentially gotten through all the defenses that you have in place at the Augusta office? And is it possible that testing is faulty? Will you be doing any retesting?
We probably the testing for COVID-19 is a negative result is especially with a high number of individual samples who were tested. Negative results are ones you can take to the bank. So we're not worried that this high number of samples could have all been falsely negative. That would be statistically improbable, given that yesterday our laboratory returned a fair number of positive results. So we know that the testing mechanism is working properly. In addition to that, Amy, the symptomology of individuals that they exhibited is not consistent with COVID-19. Individuals became they developed rapid onset muscle aches, and 12 hours later feeling better. That's really not consistent with COVID-19, which is much more characterized by lower respiratory symptoms, fever, cough, shortness of breath, as opposed to muscle aches. Now, in terms of the number of viruses that could cause this, again, the overarching symptom across all of these individuals was muscle aches. And one of the viruses that is the most notorious for causing muscle aches is the common cold. We've all had the cold, and we all know that one of the classic symptoms of the cold is you feel achy. So although, again, it's too early to tell, the common cold is probably high on any possible list of viruses that could have caused the symptoms that we saw in these individuals, which, again, were predominantly characterized by muscle aches.
Thank you. And do you have any updates on Birch Harbor, Birch Bay and Bar Harbor? We've had a couple of questions about that. Apparently, about a week and a half or so ago, an employee was identified as testing positive. But since then, there have been questions about whether or not there's been any further testing or if that person has recovered.
We'll get you any updates on that facility. As of right now, I'm taking a look. We'll get you the updates on the latest there, Amy, as soon as possible.
Okay, thank you.
Mm-hmm. We're going to turn back to Brad Rogers now. Brad, you with us? All right, we'll circle back to Brad. In the meantime, we'll go to Megan at WMTW.
Thank you, Dr. Shah. My question is about the outbreak at Cape Memory Care. Another round of testing revealed approximately 10 more positive cases associated with Cape Memory Care. And this seems like, without going through all of the numbers, one of the biggest, if not the biggest, outbreak we've had, classified outbreak. Can you talk to me about some of the things that the CDC may or may not be doing to kind of step in and give them some guidance, or why is it that the situation there has escalated to the point where no other outbreak really has seemed to?
Mm-hmm. So, it's a good question. So let me recap where things stand there and what the nature of our involvement has been. As soon as Maine CDC became aware of conditions there that constituted an outbreak, which was now well over a week ago, we immediately arranged for an emergency delivery of PPE within an hour and a half. We were on the road with an emergency cache of PPE for staff and residents at the facility to make sure that they had what they need to be protected. We also arranged for a phone call that night to go over infection control practices, as well as staffing needs at the facility, and talk about a more universal testing plan. We've been deeply engaged with the facility. I think there have been calls most every day for the past several days to check in with them to make sure they've got not just the PPE they need, but also all the resources that Maine CDC has available from a staffing, infection control, and clinical management perspective. This is an incredibly challenging outbreak, partly because of the nature of the facility, but also because of the nature of the patient population. Patient population for whom social distancing may be more of a challenge, and wearing a mask may also pose additional challenges. All of these things, I think, together find ourselves in a situation where there have been an unfortunately high number of cases, and sadly a high number of deaths. We've been continuing to work with the facility on a going forward basis to try to prevent additional introductions of the virus and to prevent additional individuals from becoming ill. But this has certainly been a very big challenge, not just, of course, for the team of epidemiologists at Maine CDC, but of course, mostly primarily for the residents themselves and the staff who have been working there. I'm going to turn now to Joe at ABC 7.
Thank you, Dr. Shah. This question may be more along the lines for your epidemiologist investigation team, but with all the tests that have come back positive, have you seen any trend or similarity, whether it's involving, talk about community transmission, whether it's involving you're finding the cases being contracted more in a public sense or more in a household sense? And could you, shed some light on or trends or things that you found on that?
Sure. So we're seeing a bit of both. We are continuing to see a high number of cases transmitted within the household. And that's been, that sort of transmission by node has continued. However, in the counties where there have been the highest degree of community transmission, that's York, that's Androscoggin County, and that's Cumberland County, we continue to see high numbers of cases of individuals who have no known interaction with any positive COVID-19 patient, not in the household, not in the workplace. That is, of course, the definition of community transmission. And we do continue, especially in those three counties, to see of community transmission across the county. I'm going to turn next to Joe Lawler at the Press Herald. Hey, Joe, I can see you, but you're on mute. I'm gonna come right back to you, Joe. I know you're. Oh, there you go. You're mute.
Oh, it worked that time.
Yeah.
All right. Okay, sorry about that. So yeah, my question is, with all the, I'm sure you're aware of all the complaints by the restaurant people, just a few days before they were geared to open up, and here, there's this change. Can you give us an idea? Are we talking weeks or months of a continued delay for them? And then I was wondering if there's also some type of middle ground, maybe allow them to open for indoor dining, but have their spacing requirements be a lot more than in the county with less transmission.
So, Joe, in terms of the duration, it really does depend on the data. There's not a particular date that we have in mind. We're not following a date, we're following the data. So that will truly be what governs how we go forward. It's and if they are more favorable, and if the case counts and the intensity of new cases, hospitalization rates, etc., turn in a direction where community transmission is lower, then that will govern things. But there's not a date that we've got on the calendar by which we're going to make a decision one way or the other. The other question you raise is one that we discussed, which is, are there middle grounds? Joe, I think the outdoor dining is in and of itself a middle ground, even though we recognize that not every restaurant can accommodate it. Is in and of itself a middle ground. There are emerging data that suggest that the risk of transmission in outdoor settings is less, if not significantly less, than in indoor settings. What we're contending with is that we don't know what the risk of transmission is in indoor spaces. Even with the engineering controls that you noted, Joe, is the capacity limit 50%, 25%? Right now, there's just not great data that shines a light on what the safe answer to that question is. What there are good data to suggest that outdoors, perhaps because of a function of natural desire for people to be more spread out outside, and perhaps other factors that have yet to be elucidated, there is a lower degree of transmission based on some early research. But the inside spaces, it's an area for additional research. But right now, it's a difficult question. I will repeat 3 words that science just don't like to say, but we owe it to ourselves to say, which is we don't know. We don't know. But as the data become more favorable, that gives us more security in moving toward indoor dining as we take a look at the daily data. Okay, I'm going to turn next to Steve Missler at Maine Public.
Thank you, Dr. Shah. Can you hear me okay?
Yep, go ahead, Steve.
Great. I did 2 quick questions, I think. One is just a little more information, if possible, on the investigation into what happened at the EOC with the workers. I know you're going to test these folks to see if there's any other diseases there, but I'm wondering if there's any change to the workplace there, climate control, something like that, that may have contributed to this, or that you're looking at, I suppose. Anything along those lines?
The answer is Steve, is that is one of our hypotheses. We understand that in recent days, I believe it was Wednesday, the HVAC system was turned back on, and that could have kicked up particles of dust that caused a very, very low level allergic reaction. And an allergic reaction, according to one of our medical officers who I was emailing with and discussing this issue with this morning, a low-level allergic reaction in some individuals can manifest like the early signs of an infection, muscle aches, etc. So, Steve, the answer is that is a hypothesis that we are looking into.
Okay. And the second question I have is just about what are you seeing? I know that the impetus for the governor sort of holding back on allowing indoor dining at the restaurants in the 3 most populous counties. Part of that metric or that rationale was hospitalization. What have you seen since then for hospitalizations, particularly in southern Maine? How is that trend looking to you? I mean, I know what the data is on your website, but I'm just curious about what you see there, what you're worried about, and do you think it's trending in the right direction?
Sure. So there, just to recap, and then I know you have the numbers, Steve, but just to recap for everybody. Right now in Maine, there are 53 individuals hospitalized, 18 in ICUs, 35 in non-ICUs. What's been of concern in recent days, Steve, is a few things. The first is that the number of ICU patients, the number of overall hospitalized patients is a good deal higher than what it was 2 or 3 weeks ago. A large number of those hospitalizations, in fact, and I'll get you the number in just a second, a good number of those hospitalizations are in the 2 large hospitals in the Portland area. What we've also seen just in the past few days is, and I'm just pulling those up right now. I guess there is a benefit to doing these on Zoom because I've got all the numbers right here. So just put it in a little bit of perspective. At the 2 large hospitals in the Portland area, Maine Med, there have been a total of 117 hospitalizations, and at Mercy, a total of 21 hospitalizations, but an uptick at both of those facilities in recent days. One of the concerns that we've had just more recently is a change in the composition of who has been admitted to hospital, which is individuals from assisted living facilities. These are facilities, of course, that are staffed by folks from the outside, which again tells us that there's ongoing community transmission and it's being brought into facilities. It doesn't, as the governor has noted, it just doesn't appear in a facility, it has to be brought in. And so those are some of the signs we've been seeing on the hospitalization front. I believe the next question goes to, we're going to try Brad Rogers one more time. Well, Brad, if you've got a particular question, please email it to Robert Long and we'll get you an answer. And the last question for today goes to Patrick Whittle from the AP.
Thank you very much. This might be a little too much of a later hole, and it might also not be a question for you, but the DOJ issued a statement today stating that it believes that the state's restrictions on campgrounds are not constitutional, and I'm curious if the state has a plan to respond to that in any way.
Yep, I'm aware of those pronouncements. For a number of reasons, I'm going to refer a comment to the governor's office. There's been a lot of discussion on that topic, and I'll probably the governor's office is in a far better position to provide a complete answer than I can.
Got it.
But I do appreciate the question. So as we wrap up, I wanted to just provide a preview for.
Yeah, I think that Brian Sullivan from WABI here. Before you wrap up, I wonder, we all just received an executive order from Governor Mills' press people about an executive order that allowing for the easing of restrictions and restarting Maine plan that progresses. Can you just talk how closely you've worked with the governor about this? I'd ask you to just speak for her, but just tell us a little bit about this order and why you felt some of it was necessary, at least in your conversations with her.
Sure. So our team working with the commissioner's office and the governor's office have been in very frequent contact. We speak quite often about the emerging data and what the potential policy prescriptions coming out of those data should be. As it relates to this particular executive order, I think, my view is that it largely speaks for itself. I think the data suggests that based on where we are, this was a prudent set of steps to take, but happy to discuss it more. But I think the bottom line, candidly, is we are in very, very close contact with the governor's office and the commissioner's office based on all of the data that our epidemiology teams are seeing on a daily basis. So with that, everyone, I wanted to just take a look into where things might stand for next week. Again, our investigation into the situation over at the State Emergency Operations Center is ongoing. And we are not sure whether we will be back in person there, or at least in the limited crew that was there, or whether we might be completely virtual next week. We'll keep everyone posted as we go through the weekend and into the week as to what these briefings look like going into next week. But I would like to say for everybody, particularly our colleagues in the media and everyone who's tuned in, very much thank you for your flexibility in rolling with us as we've shifted. I think the one thing we've all learned about ourselves, at least for me, thinking about COVID-19, is that just when I thought I couldn't change the way that I do business anymore, something happens and we realize we're able to reach just a little bit further to accommodate the changes that are in front of us. This most recent change is just another example of that. I really do thank everyone for accommodating this, changing your own operations as we've had to change our operations. We are pleased that all of the results have come back negative, and individuals who were showing symptoms are largely feeling better. That's a good thing, and a piece of good news at a time when there's not a lot of it around. With that, everyone, I would like to ask everyone to take some time this weekend to take care of yourselves. This is a long road that we have ahead of us. I look forward to talking with everyone early next week. Take care.